Ripple effects of the new federal budget law may impact Nebraska. Local 4's Ian Mason is at the alert desk with how these changes could hit your wallet.
The federal budget bill was recently passed, is very broad, touching a lot of aspects of people's lives. And one of the big headlines is that programs like SNAP and Medicaid are being cut. But it isn't that simple. The federal government disperses funds to the states to pay for these programs. And without these funds, the states will have to make up the difference. A new federal budget in Washington, D.C. means new challenges for the states and their own budgets. With federal cuts to state programs approved, that leaves states like Nebraska scrambling.
We could be looking at a loss of several $100 million. And again, are these numbers that the state is necessarily going to have to backfill? That'll be up to policymakers at the state level.
State Treasurer Tom Breezy, a supporter of the federal budget, says that reforms to aid programs are needed, even if that makes lawmakers' jobs harder. However, some in the state, like Nebraska Democratic Party Chair Jane Klebb, see things a bit differently.
There's about 78,000 Nebraskans who are now going to be without medical care. And that is going to mean more money that counties and our state are going to have to come up in order to meet those healthcare needs of the least among us.
With the example of Medicaid, hospitals are required to treat anyone that comes into their emergency rooms, whether they have insurance or not. The federal government used to help pick up some of that cost, but with the new budget, the federal government shifting that responsibility to the states, who will now have to find the money to pay for it, or risk consequences like rural hospitals closing. Treasurer Breezy, optimistic about the situation, though.
We'll have to make this work, and the state's current fiscal situation is predicated on revenue projections that are probably fairly conservative.
While state lawmakers wrangled with the budget deficit last session, the treasurer says the state now has a few tricks up its sleeve to help avoid cuts.
Actual revenue tends to outpace the projections, number one. The budget the legislature passed this last session, it also assumes spending growth of about 1%, which is fairly conservative, but we could probably do better. And the ongoing efficiency review that has been undertaken by the Pillen administration.
Treasurer Breezy added that with the efficiency review, the state will be looking at those who receive programs like Medicaid and SNAP and refining eligibility. But Chair Klebb says she worries the cuts will go too far and kick people who need Medicaid and SNAP off of the programs.
This is now a crisis that the federal government has now pushed down to state and local governments. And that is not what we want to see happening. Medicare and Medicaid work. So it's our responsibility now as Democrats to really make sure that folks understand what's in this bill, which means a lot more pain for a lot of working class and middle class Nebraskans.
While most cuts don't go into effect until 2027, this is sure to come up during the legislature's next session, which starts in January. And you can check out the full article on our app for more details. Alyssa?